Hi, my name is Caitlin Bailey. This is my client Brian. Today we're taking some baseline measurements and some assessments of blood pressure, body composition, and flexibility. So we're going to start with blood pressure because Brian's been seated for about 5 minutes, so I know we're going to get a true resting blood pressure reading because he's relaxed. First thing we need to do is find proper positioning of the cuff. So we're going to want the cuff about midway up the upper arm in line with his heart. And we're going to want to line up with his brachial artery. So first I'll palpate for his brachial artery. Good. Once I found that, I'm going to line up the cuff with the brachial artery. So this cuff actually has an indicator. It says artery right here. We're going to line that part up with the brachial artery and secure the cuff, making sure it's not too tight and not too loose. Okay. Once the cuff is secure, I'm going to palpate that brachial artery again, and that's where I'm going to place the diaphragm of my stethoscope. So I want to make sure we can get over the brachial artery without going underneath the cuff. Good. So once I have that, I'm going to fill up the cuff, inflate the cuff to about 160 to 200 millimeters. And as I slowly let the pressure out, I'm listening for two sounds. First sound will be Brian's systolic blood pressure. Good. And then the last normal sound I hear before the sound starts to muffle will be his diastolic blood pressure. So for that, I got 110/80. I'm going to take a second reading to ensure its accuracy. So again, palpating for that brachial artery. I'm going to go ahead and inflate the cuff to 160 to 200. And then slowly let the pressure out, listening for those two Karat cough sounds. Good. Letting the rest of the air out, I got a second reading at 110/80. So comparing that to our average standard of 120/80, Brian is within the normal range and we don't have any concerns about his blood pressure. The second assessment is going to be joint range of motion. You can lay down on the floor. Good, so I'm going to assess Brian's joint range of motion using a goniometer. Okay, I'm going to have him lie in a supine position. And the first reading we're going to get is of his elbow. So we're going to get elbow flexion by lining up the axis of the goniometer with the lateral epicondyle of the humerus. Good, so the stationary arm is going to be in line with Brian's humerus, and then the movable arm is going to be in line with his radius. So go ahead and flex your arm. And following in line with the radius. Okay, we get a reading of 120 degrees for Brian's elbow flexion of his left arm. The second reading is going to be flexion of the shoulder. So for this, I'm just going to find the midpoint of the shoulder to place the axis. I'm going to have the stationary arm in line with the midline of his body. And then at onset, the two arms will be stacked. And then as he starts to flex his arm, I'm going to have the movable arm follow the humerus. So go ahead, keeping the arm straight, flexing at the shoulder. Good, and I'm looking for disturbances in the torso. So make sure that we're getting an accurate reading of the joint. Good, and for that we have 154 degrees of flexion at his shoulder. Brian, let me know if you have any pain with these and we'll stop the assessment. Okay, the next measurement will be of his hip flexion. So for this we're going to put the axis of the goniometer on his greater trochanter. Again, we're going to have the stationary arm in line parallel with the midline of his body. And then we're going to have him lift his straight leg up. Now, I'm looking for disturbances in the lower back. I'm also looking at the other leg that we're not assessing. As soon as that leg starts to bend, we're not getting a true range of motion reading for this left hip. So go ahead and raise your leg. The movable arm is in line with the femur. Good. And we get a reading about 50 degrees for Brian's hip flexion. Last one on this side, I'm going to look at his knee flexion. So first just draw the heel towards your glute and straighten the leg back out. Any pain with that?
No.
Great. So I'm going to take the stationary arm in line with his femur. I'm going to have the axis of the goniometer in line with his lateral femoral epicondyle, and then the movable arm in line with the midline of his fibula. So go ahead and bend that knee again. Good, straighten it back out. I want to make sure we're not getting any rotation in the pelvis, so I'm going to palpate the anterior and posterior superior iliac spines. Okay, let's try that one again. Go ahead. Okay, so I'm getting a little rotation there, so that's where we'll take our reading. Again, lining up with the femur and the fibula. Okay. And then we get a reading of 110 degrees for Brian's knee flexion. I'm just going to have you turn around to take all the measurements on the other side. So again, starting with his elbow flexion, this time on the right side of his body, lining up, arm, go ahead. As he flexes, I'm going to follow the radius. Okay, we get a reading on this side of 131 degrees of flexion. Moving on to his shoulder. Again, we're going to have the arms stacked at the onset. Okay, axis point in line with the midpoint of his shoulder. Go ahead and flex your arm. Going to let the movable arm follow his humerus. Watching for disturbances in the torso. Okay, we get a reading of 173 degrees for the flexion of this shoulder. Let's go ahead and move to the hip. Again, having the arms stacked at the onset, lining up the axis with his greater trochanter. Go ahead, lift the leg. And of course, I'm looking for disturbances in the other side, making sure that leg doesn't lift up. And we get 70 degrees of flexion for this hip. Lastly, moving to the knee. First, checking for pain, so go ahead, bring the heel towards the glute. Any pain?
Nope.
Go ahead, extend back out. You're going to palpate the hips again. Make sure we're not getting any pelvic rotation, which would give us an untrue reading of knee flexion. So go ahead, flex the knee. Good, stopping right there. I'm going to place the axis. Stationary arm on the femur. Midline of the fibula. Okay, and we get a reading of 125 degrees of flexion for the knee. Thank you. Okay, and then next assessment of flexibility will be the sit and reach. So I've already set up the sit and reach here for Brian to do. So we have a measuring tape set out, and then we have a piece of tape marked over 15 inches. So for the sit and reach, which is going to be testing the flexibility of his hamstrings and lower back, I'm going to instruct Brian, keep your knees straight throughout the assessment and keep your hands stacked and even. So as you inhale, I'm going to lengthen through the spine and exhale, reach forward along the measuring tape. Good, and then I'm going to see where he can hold for 2 seconds, which is at 14 inches. You can go ahead and relax. I'll give him a second try. So again, inhale. Looking to make sure the knees remain straight, the hands remain stacked. Exhale, reach forward. And holding for 2 seconds right above the tape line. So we have a second reading of 15 inches for Brian's sit and reach. Okay, for the rest of Brian's assessments, I'm going to have ask him to remove his shirt. We're going to take 3 measurements using our skin calipers, a measuring tape, and a pen to mark on his body. So with these 3 measurements, we'll be able to sum up the measurements, and then using table 8.5 in our text, finding Brian's age, we'll be able to find his approximate % body fat. So we're going to look at 3 different areas. The first one's going to be the chest. So to find the area where we're going to take our fold, we want to, thank you. We want to take a measurement from the axillary line to his nipple line, a diagonal measurement. So that's 4 inches. So we're going to find the midpoint of that measurement, which is 2, and that's where we're going to make our marking for his chest measurement. Okay, so for this one, you're going to take a diagonal fold. So right along the line where I measured, I'm going to pinch about 3 inches of skin, so 1.5 inches on one side of the marking and 1.5 inches on the other side. I'm going to take a pinch, pull the fat away from the muscle, and then using the skin calipers, I'm going to measure the belly of the fold. And we get 22 millimeters. I'm going to mark that down with my pen. Okay, the second reading is going to be of his abdomen. So to find this area, we're going to go 2 centimeters away from his umbilicus. And that's where I'm going to make my mark. Great. So this time I'm going to use a vertical fold. Again, trying to get 1.5 inches on either side of the marking. I'm going to pinch the skin and pull away. And then measuring the belly of the fold with the calipers. And I get 28 millimeters for that reading. Okay, the third area is going to be the thigh. So for this one, just shift your weight over to the left leg so you can relax your right leg. You can bend the knee a little bit and then roll up your shorts. So to find this area, we're going to mark the midpoint between the hip crease and the superior aspect of the patella. So that's where I'll measure from. And I get 17, so we're going to mark at 8.5. Okay, and that's where we'll take, again, a vertical skin fold here, so pinching about 1.5 inches on either side of the marking. Good, and pulling the fat away from the muscle, using the skin fold calipers, and looking at the belly of the fold. And I got 25 millimeters for that measurement. So now to make sure that everything's accurate, I'm just going to repeat. I've already marked the area that we'd be measuring. So now I can use those same markings to repeat the measurements. So again, getting a 3-inch skin fold, pulling it away from the muscle. Again, we got 22, which is the same as our first reading. Moving on to the abdomen, pinching and pulling away. And again, we get a reading of 28. And then once again, shift your weight over to your left leg, using that same marking that we had before for the thigh measurement. And we get 25 millimeters. So all his measurements were the same, so no third round of measurements is required. The last assessment we're going to do is taking some girth measurements of Brian's waist and hip. For his waist measurement, we're going to find the narrowest part of his waist. Wrap the measuring tape around. Just have him relax his arms and exhale. Good, and we get a measurement of 36 inches. So for these measurements, you want to make sure that the tape remains horizontal and it's not too tight, but not so loose that it deviates from that horizontal line. So 36 inches for Brian's waist. And then for his hips, I'm going to have him stand with his feet together. And then using a lateral view, I'm going to look for the widest area of his hips, which is about midpoint on the glutes. And I'm going to go for the same horizontal measurement. And just exhale, relax. And for Brian's hips, we get 42.5 inches. So mark that down. All right, thank you, Brian, for all those assessments. I'm going to use these measurements that we took today to assess his body composition, and that will tell me how I can best program his exercise prescription. Thanks, Brian.
Thank you.